Hi, my name is Dr. Wajde Dabah, interventional pain specialist out of Chicago, Illinois. So I'm here today to kind of talk about some different modalities that we can use to treat patients' chronic pain while we're all in this shelter-in-place order, which has been going on for about 4 weeks now for about 95% of all Americans. And one of the strongest reasons why I'm doing this is because I've been noticing a slightly concerning trend among providers to be prescribing to more medications for patients' chronic pain, including narcotics and controlled substances. And while that may initially seem like a not a big deal or a okay temporary solution, there are a lot of long-term negative consequences that can happen for patients and for the society as a whole if we continue on that trend. And so the point of today's talk is to kind of discuss other modalities that we can use while patients are home to help control their pain. One of the first things I think about is utilizing bracing for patients' chronic pain. There's been studies that show that bracing decreases narcotic consumption, it improves pain scores, decreases the chance of re-injury. So a lot of these places will offer, these companies that provide bracing will actually send out the bracing with a physician order, send it directly out to patients in their home, and then they can either contact you as the provider or even the bracing company to figure out the proper way to use the brace. So that is an excellent modality that we can use. Other things that we can use. So a lot of physical therapy centers are still open, and that can definitely be utilized, but it does come with an increased risk of exposure by leaving the house in the COVID-19 situation. So I strongly encourage patients to contact their individual providers to see if that's a good idea for them. That comes down to a risk and benefit ratio. So for some patients that may be okay, but some patients at a higher risk may not want to increase their exposure risk. Now there are physical therapy centers that will come directly to your home. And in that case, they, for the most part, should be wearing PPE equipment, as well as the patient should always be wearing protective mask as well. Other different options we have. So the use of electrical stimulation devices is excellent. One in particular that I like to use is a device called H-Wave. H-Wave works a little differently than a typical TENS unit by the fact that it actually has been shown to work by increasing blood flow and lymphatic drainage, therefore decreasing swelling, improving tissue regeneration and range of motion and things like that. So for now, for a lot of patients, a standard TENS unit may be effective and control their pain, but for patients a little more advanced pain, something would be considered to using an H-Wave device. Other different things that we can use is non-narcotic medications. There's a lot of adjunct therapy that we can utilize besides controlled substances for pain. And so I strongly encourage each provider to look at exactly what modalities that the patient has would be best effective for the patient, and to really think twice before just increasing or bumping up a patient's controlled substance for their pain control. If anybody else has any additional modalities they'd like to share, please comment, share with everybody things that you've successfully used to help improve your patient's pain scores. For now, I hope everybody stays healthy and safe, and we'll get through this together.